Imagine waking up one morning and watching your own hand pick up a knife. You didn't tell it to, you didn't want it to, but your hand had already decided. Now imagine that happening every single day. Your hand unbuttoning your shirt while you try to button it. Your hand grabbing strangers in public. Your hand holding a pillow over your own face while you sleep. This isn't a horror movie. This isn't a nightmare. For a small number of people around the world, this is their daily reality. And doctors are still struggling to fully explain it. This is the story of alien hand syndrome, one of the most bizarre and shocking medical mysteries ever documented in modern neuroscience. Alien hand syndrome is one of the most disturbing neurological conditions ever recorded in medical science. It was first formally described in 1908 by German neurologist Kurt Goldstein after treating a patient whose left hand would strangle her own neck without her knowledge or consent while she slept. The condition occurs when one hand begins acting completely independently from the person's conscious will. The hand moves, the hand grabs, the hand interferes, and the person it belongs to has absolutely no control over it. Patients often describe the experience as watching a stranger's hand attached to their own body. Some give their hand a separate name. Some hold it down with their other hand just to stop it from acting out. The condition is extremely rare, with only a small number of cases ever formally documented in medical literature. It most commonly appears after brain surgery, stroke, brain tumors, or degenerative brain diseases like Alzheimer's. The symptoms of alien hand syndrome vary depending on which part of the brain has been damaged, but they follow a deeply unsettling pattern. In some patients, the alien hand is purely reflexive, grasping anything it touches without the person intending to hold it. A doorframe, a stranger's arm, a hot stove. In others, the behavior is far more purposeful and disturbing. The hand will actively work against whatever the person is trying to do. If they try to write, the alien hand crumples the paper. If they try to eat, the alien hand pushes the food away. If they try to get dressed, the alien hand undresses them. In the most extreme documented cases, patients have reported their alien hand attempting to choke them during the night. One patient described lying awake, physically wresting their own left hand away from their throat with their right. What makes this condition so psychologically devastating is that patients are fully aware of what their hand is doing. They can see it happening. They simply cannot stop it. So what is actually happening inside the brain? The human brain is divided into two hemispheres, left and right, connected by a thick bundle of nerve fibers called the corpus callosum. Under normal circumstances, these two hemispheres communicate constantly, coordinating every movement your body makes without you even thinking about it. In alien hand syndrome, that communication breaks down completely. When the corpus callosum is damaged or severed, through surgery, stroke, or disease, the two hemispheres lose their ability to coordinate with each other. Each hemisphere begins operating independently, issuing its own movement commands to whichever hand it controls. The result is two separate command systems running in the same body at the same time, one under the person's conscious control and one that is not. Brain imaging studies of patients with alien hand syndrome have revealed something remarkable. The motor cortex, the region of the brain responsible for conscious movement, shows normal activity in the dominant hand, but in the alien hand, activity originates from entirely different brain regions, areas associated with automatic and reflexive behavior rather than conscious intention. In other words, the alien hand isn't malfunctioning. It is functioning perfectly, just under a completely separate set of instructions that the conscious mind has no access to. Because alien hand syndrome is so rare, there is no single cure. But doctors have found several approaches that genuinely help patients manage the condition and reclaim their daily lives. The most effective immediate strategy is simply keeping the alien hand occupied. Patients are taught to give their alien hand an object to hold: a stress ball, a rolled towel, a book. When the hand has something to grip, it is far less likely to interfere with whatever the other hand is doing. Botulinum toxin injections, Botox, have also been used successfully in some cases to reduce the alien hand's movement by temporarily weakening the muscles involved. This doesn't cure the condition, but gives patients meaningful relief from the most disruptive behaviors. Mirror therapy, a technique originally developed for phantom limb pain, has also shown promising results. Patients use a mirror to create the visual illusion that both hands are under conscious control, which can help retrain the brain's movement coordination over time. Perhaps most importantly, the underlying cause matters enormously. Patients whose alien hand syndrome developed after a single stroke or surgery often see gradual improvement as the brain heals and rewires itself over time. Several documented patients have reported significant reduction in alien hand behavior within months to years of onset, as the brain slowly compensates for the damaged connection. Alien hand syndrome forces us to ask a question most of us have never had to consider. How much of what your body does is actually you? We assume complete ownership of every movement we make, every reach, every gesture, every touch. But the story of alien hand syndrome reveals something deeply unsettling, that the sense of control we feel over our own bodies is itself a product of brain function. And when that function breaks down, even something as familiar as your own hand can become a stranger. If this video helped you understand something that was once invisible to you, share it with someone, because the brain is far stranger and far more fragile than most of us ever realize. This has been Condition Unknown. Until next time, keep asking questions.